At the start of the pandemic, the FDA had warned the U.S. drug supply could be distributed as a supply chain slowed or got cut off altogether. But with dozens of prescriptions still in short supply, some of you are asking us if COVID is still wreaking havoc on the system. Our Vanessa Rufus joins us now to verify.
So a viewer recently emailed saying that a prescription she's been taking for the past 30 years has been out since September. And so she wanted to know if this was pandemic related. She also wanted to know when this drug would be back and if other drugs have been impacted in the same way. So let's verify. Our sources are the FDA and Michael Gagnon with the American Society of Health System Pharmacists. We also went straight to Teva Pharmaceuticals, the sole maker of Nefazodone, the specific drug our viewer wanted to know about. First, Teva tells us it's been dealing with a shortage in raw material needed to manufacture Nefazodone, and it does not have an ETA on its return to the market. But a spokesperson tells us the shortage is not pandemic related. That brings us to the next question. Right now, the FDA is tracking more than 100 drug shortages, but are any of these due to the pandemic?
Early in the pandemic, we had problems with some of the medications that are used for intensive care units for patients, particularly on ventilators. We're not seeing anything that has persisted throughout the pandemic.
Gagnon says the shortages now are really just proof of ongoing supply concerns that predate the pandemic.
One of the silver linings to the COVID pandemic has been more emphasis on the supply chain. We'd like to see more redundancy in our manufacturing. There should be action plans readily available for when something breaks down.
So we can verify any pandemic-related drug shortages have largely let up. And so anything we're seeing right now is really just proof of ongoing concerns that predate the pandemic. With your Verify, I'm Vanessa Rufus.